Wednesday afternoon. Happy that you've joined us today on this Facebook Live with my friend, Dr. Glenda Wren. Dr. Wren. Glenda to me, Dr. Wren to you. Her list of accomplishments is about a mile long, and I'm not going to even attempt to do them all, but let me just tell you that she is an amazing woman and an amazing friend. Right now, she is the director of the Kennedy Satcher Center for Mental Health Equity, and she was a speaker at our 2015 Gathering on Mental Health in the Church. So welcome, Dr. Wren. We're so glad that you're with us today.
Oh, thank you for having me, Kay. It's great to be here.
Good. Well, like I said, the list of accomplishments would take about 3 pages worth. So just briefly introduce yourself to your audience, to our audience, and tell us, a little bit of your story. And then we'll come back and talk about what you do professionally, but just about you. What's kind of your story?
Yeah, well, if you ask my identity first, I'm a God lover, a person of God, and that my faith relationship is very important to me. I'm also a wife. I have 3 wonderful children, and I always like to remind myself that that's kind of the reason why everything else happens is, our relationships really matter. And I've been blessed to have a wonderful opportunity to be gifted in medicine and go to medical school, and am a psychiatrist by training. And, we'll talk about some of the experiences that led to that. And my day-to-day job is amazing. I get a chance to not just see patients one-on-one, but also positively influence the communities and the health systems that take care of people. So it's really fun work, and I get to meet people like you, and also just a lot of change makers out in the community doing great work.
Well, I know that you served in the military yourself, in the armed forces, and one of the reasons that we're talking with you right now is because Memorial Day is coming up on next week, and we wanted to talk about our veterans and their mental health, and what happens when sometimes the wounds of war, the internal wounds of war, can create problems for veterans. So we want to honor our vets, and we want to talk specifically about it. But you can talk so personally about this because you served in the military. And can you tell us a little bit about that and how that experience informs what you do today?
Sure. So I went to the United States Military Academy for college, also known as West Point, and had a really interesting experience there, like everyone did. Loved it and really loved the military, was excited about my future serving as an officer in the Army. But, God had a different plan. And even though I was really set on that future, shortly before my senior year there, I was in a near fatal car accident and ended up spending many months at Walter Reed Hospital recovering. Wanted to stay in the military, but my injuries were too serious to allow that. So I graduated from West Point and was not commissionable because of my medical conditions. But I was accepted to medical school, ironically, while I was still a patient at Walter Reed. So I was able to reclaim that vision of being a physician. And I didn't really think that those experiences in the military would mean as much as they do. But I really got exposed to a culture that is not common because we have a volunteer military. I didn't realize that there's so many Americans that just don't have a reference point of understanding what that culture is like. And then as a provider, seeing veterans, I didn't realize, because I didn't end up serving in active duty in the field, and I didn't realize how PTSD was so pervasive and how difficult some of the consequences of things that we were all trained for could be. And that really moved me. And my interrupted service, I think, is something that drives me also to make sure I can make a positive contribution in the lives of veterans, because we did take an oath of having a lifetime of service to our country. And there's a lot of different ways that you can serve.
Just for somebody who's listening who isn't exactly sure what PTSD is, and Rick always says it PST, and then he started probably can't ever quite get those initials in the right order. So in case somebody else isn't quite sure what that is, just can you maybe explain that?
Sure. And some people even say PTS because they don't like the disorder part of it. So it stands for post-traumatic stress disorder. And it's a condition that can happen if you've experienced a frightening, near fatal, or dangerous situation, such as combat in the case of service members, but also sexual assault, being held at gunpoint, or even hearing or witnessing a death or hearing about a death of someone that was close to you can actually be a cause for post-traumatic stress disorder. And what happens is that a bad thing happens to you in your past, and you're so impacted by it that your body kind of doesn't really move forward in the future. In some ways, you can be triggered to re-experience that trauma, to feel like it's happening all over again. And then, you start to avoid things that remind you of that, because we're trained to avoid fear and to seek pleasure. So even without thinking about it, people automatically find themselves doing that, and they may be watchful and on guard. It's actually a pretty difficult diagnosis for regular people to make on themselves. I think depression is a little bit more intuitive. You can kind of figure out that you're sad. But many of the patients that I have seen for post-traumatic stress disorder, they often have been diagnosed as depression or something else. And they have a hard time putting together that, they think, oh, only war veterans could get PTSD. And a lot of veterans have PTSD from sexual trauma and not actually from combat. So there's a lot of important information that's important for regular people to know about that.
And do you see that in all veterans? Is this something unique to the wars in the last decades? Is this something that's always been present in those who have gone through combat or experience? Tell us about that.
Yeah, that's a great question. The name has changed over the years. Even as long as wars were fought, there were people that identified individuals that had shell shock or battle fatigue. They had these other names attached to it. And then over time, we realized that it was a medical condition that's driven by, brain structures, and it could be treated in a variety of ways. But what's also important is that the most common reaction to a traumatic event is recovery. That's kind of wonderful news, that 60% of people that are exposed to a terrible event like that will actually recover. Maybe they'll have a difficult time in the short phase, but recovery is actually the most common outcome. But
for people, I spoke over you. What percentage?
60%. Yeah, that's great news, right? So it's not like every veteran is going to get this if you go into combat. But for some people that have genetic vulnerabilities, other pre-exposure conditions, childhood adversity, they are at high risk of not properly recovering from that traumatic event, and they can suffer quite extensively if they don't get treatment for it.
Well, we'll talk as we go on about, how the faith community can serve veterans, and maybe some things to avoid asking and some things to ask, and, ways to come alongside returning veterans. But just now tell us just a little bit about your role at the Kennedy Satcher Center for Mental Health Equity. That long title. Tell us just a little bit about what that is, and then we'll kind of go back and talk about veterans.
Hold on. Sorry about that.
No problem.
This is like fancy technology in your office where if you don't move around enough, it turns out the light.
Technology, that's right.
Here at Morehouse School of Medicine in Atlanta, we have the Satcher Health Leadership Institute, and my center is housed within there. And it's a really wonderful center, I think. I have the pleasure of being the director of the center. We have leadership development programs for parents that we train across the country, as well as a program to help primary care sites integrate behavioral health in their practice. And we have research activities that some of our faculty do related to criminal justice and mental illness and resilience building interventions. And then we have a whole scope of work around policy work that we do around parity. So making sure that mental health conditions are covered equally as other conditions as it relates to insurance. But the broad overarching theme is we want to make sure that our future is one where people can get the help that they need when they need it in settings where they feel safe, and that they will get the resources that they need. So you will align those resources with need. And that's kind of the general definition of equity.
So you mentioned the word parity, and that's a term that I'm familiar with because of just my work as an advocate in mental health. But in case someone isn't quite sure what that means, and they might not even really know what the law has mandated about Well, you speak about it. You tell it. You talk to us about parity.
No, it's important. In 2008, there was a law that was passed, the Mental Health Addiction Equity Act. Mental health, I'm going to mess that one up.
I know. I always. That's why I ask you to do
really long. And Patrick Kennedy was a lead sponsor on that bill. Before that was passed, it was okay and actually quite common for insurance companies to make it more difficult for you to get mental health care. So, for example, if you have diabetes and you need insulin, no one thinks that like after getting insulin for a year, you should like work harder and make your pancreas produce insulin. But for some reason, if you have depression and a chronic form of depression, they would put limitations on how long you could get treatment or how many inpatient days you could get, how many outpatient visits you could have. And, you know, there's historical reasons for that, but this law was passed to say that's not okay. And if you can't put more restrictions on one condition compared to another just because it's mental health or substance use disorder. So that's a federal law that was passed. And this October will be actually the 10th anniversary of that law. 10 years is a long time, but it takes a long time sometimes for laws to be implemented. So some of the work that we do has to do with working with states, making sure that they are passing state laws that reinforce that, and working alongside insurance companies, advocates, and others to make sure that they know how to be in compliance with that law. So the state insurance commissioners, that's the title of the person that's responsible for enforcing the law. And with the Kennedy Forum, they have developed resources like paritytrack.org, parityregistry.org. For those viewers that are interested in learning more, you can go there and learn as much as you would like about parity and the parity law.
Well, so, and on a really practical application of that, if you are someone who is living with a mental illness or your loved one is, and you have been denied, you know, your insurance company has denied you coverage or full coverage for a mental health condition, as Dr. Wren was saying, if you go to paritytrack.org, and not only can you find out about it, but you can actually register your story as here's the incident in which you were denied coverage or adequate coverage, and they're collecting those. You can also talk to, she said, the state commissioner. Is it state commissioner of insurance?
State insurance commissioner. And on Parity Track, you can look up your state and find out who your insurance commissioner is too. And
you can report it. You can report that.
And you can actually file an appeal. So Parity Registry is important because a lot of decision makers, they don't have the stories. Now we have the stories because we're living it every day, but there's a gap. And that's a really important way that people can have their voice heard. And we can also use that information to advocate for changes and greater enforcement.
You know, as somebody who, my son had severe mental illness for so many years. And I was telling somebody yesterday in advance of this Facebook Live that there were so many times that we were denied coverage or he didn't get the what he needed, the number of days that he needed in hospitalization. But I never fought it. And the reason I never fought it was because I didn't have the energy. It took so much energy just to care for Matthew, just to interact with him when he was in a severe mental health episode or interact with the hospital so that I had the financial resources that we could go ahead and pay it out of pocket. It made me mad and I would argue with the folks, but I never really fought it because it just took too much energy. And so I'm thinking of folks who might have had the financial resources that we did. And also then they're fighting the lack of energy that it's taking to care for their loved one. And now we're asking them to go and fight this battle with the insurance company. And it's really hard. I have great empathy. I know you do too. And what you're working toward is to make that happen less and less and less. Exactly. So that mental health conditions are covered at the exact same rate as any other illness. And so I applaud that work of the Kennedy Forum, Kennedy Satcher Equity Center. And when you spoke at our gathering at Saddleback Church on mental health in 2015, you talk about that those of us who have not been in the military, who have not experienced that culture, have not had that, as we don't always understand the culture of the military. And so when returning vets come, we don't quite know how to welcome them home appropriately. We don't know how to help reintegrate them into civilian life. and we don't always know how to support their families. So what is a typical experience, if there is such a thing, for a returning vet? What challenges do they face that
Well,
the average person might not understand?
yeah, I mean, I think that it's something that is hard to understand the depth of the culture that the military provides, especially if you think of someone who joined when they were 17 or 18. Yeah, I was 17 when I was very impressionable. And then when you learn how to be an adult, you learn how to do all these different things, and then to try to reintegrate into civilian life where there are all these important differences, you're trying to relearn different expectations. A common example of this is about timeliness. So in the military, the time is the time. Like, you're going to be 10 minutes ahead of time if your appointment is at 4 o'clock. You're not going to be strolling in there at 4:01. It's very disrespectful to be late. And very often you'll see, as a provider, I can see that in patients that they're very annoyed if you're running late. And that seems like a nominal thing, but there's so many examples of things like that a regular person wouldn't understand. Why are you so upset? I'm just 1 minute late. Well, in the military, that's a different culture. But there's also a loss, in a sense, of reintegration. The military is kind of a family. There are norms, there are customs, there are inside jokes. And when you've been living and breathing that, especially if you've been deployed and had like life-changing situations with a group of other people, there is a loss of that can happen when you're then coming back to a regular world surrounded by people who may have negative views on the military that they share, may not understand the personal sacrifices that you've had to make in the service of their freedom, and may experience people that are just afraid of you because they don't know. And we live in kind of a dangerous world, and people may think, oh, you were in the military, you have PTSD, I need to be afraid of you. So you can feel really like a fish out of water, I think, at times. And there's sometimes, big ways that people experience that, but also smaller ways that you experience that when you're trying to reintegrate into civilian life.
I've read some other like the number one and two and three things that vets experience when they come home. Many have trouble with becoming employed, gainfully employed outside of outside the military culture. What are some of the other practical, like you talked about the separation from a group with shared experiences and that community, that loss of community, and even the structure, that the military provides. But what are some of the other challenges, both from a mental health perspective and just from a day-to-day, what are some of the challenges that vets face and their families?
Right. Well, it also depends on how long a person has served and what their experience was like in the military. Obviously, it's going to be different for someone who's been in for 20 plus years versus someone who served for 3 or 4 years. And it's going to be different for someone who was deployed and on the front lines in combat arms than someone who, worked more in a traditional office type setting. So that there's a lot of variation in military functions and roles. So that's important to know. Good grief.
My arms from here and making periodically. Calisthenics, okay, there you
go. So that's important. But for families, I think that's another important challenge. Military families face challenges managing moves and things like that. And then the children also experience a lot of stressors in being in the military, and then similarly coming to a regular civilian life can be hard in that regard. So I think the personal challenges that someone faces as an individual with the cultural transition from being in the military versus reintegration to civilian life, as well as the family challenges in settling down, deciding what they want to do. And that's not even addressing if there's a mental health issue. This is just regular transitional issues, right? So if you add on there depression or alcohol use disorder or post-traumatic stress, or traumatic brain injury, which is another really troubling thing with these recent, the way that warfare is now, people are surviving, but they have more serious injuries that they're having to deal with. And that's an additional burden that families and individuals have to bear.
And so how do you see that playing out in the lives of veterans? How do you see all those stressors coming together in such a way that a vet begins to really struggle? How do you see that playing out?
Well, I serve at the VA. We have a clinic for women veterans there, and a lot of them have a history of military sexual trauma. The women I serve really range from people that are, were colonels to those that were enlisted, and they face a lot of trouble with work. Oftentimes, they may have difficulty with the male supervisor who maybe is a trigger for them, and they may either be too passive or too aggressive and lose their job. I've seen both of those things happen. They also struggle with just feeling, in the case of someone who's also African American, they're dealing with a different society than the military, which there's still, bias in every environment, but there's also rules and standards. And I've seen people really struggle with dealing with the racism that's so pervasive in their communities and in their workplace settings. So employment is a really big area where people struggle if you have a mental health condition in particular. Trying to navigate that and maintain functioning when you're dealing with symptoms and getting the supports that you need can be difficult.
Have you also noticed, you mentioned some women of color experiencing difficulties in their job because of the different culture between the military and civilian life. Have you also noticed, or what do you know about the disparities of veterans of color accessing mental health care? Is there disparity there? Is that, talk to us about that.
Yeah,
And
we know that
disparity, even just define disparity, what,
yes.
what we mean by that.
So disparity is kind of a specific form of difference. So difference is just, there's a difference. There's a difference between group A and group B in how often they go to see a doctor. And that could be because, group A isn't as sick and they don't need to see the doctor as much. That's just a difference. We don't consider that a disparity. Disparity refers to a difference that's based off of something inequitable, like the system is set up in such a way it makes it harder for certain people to get care, or a disparity in outcomes, for example, can be a disparity in how people are treated and how easy it is for them to get better when they do get care. So typically that refers to an unfair difference or a difference that shouldn't be there. It's not clinically appropriate, and it's something that we think should be fixed and minimized.
And so do you see that? Do you see that kind of disparity as being an experience for veterans of color and their families?
Yeah. And, keep in mind that across the board, people that have mental health symptoms often wait a very long time to get care. So there are existing disparities that exist just from having a mental health condition compared to medical condition. Within that, you see worsening disparities for individuals of color for a number of reasons. What I also see is women of color and people of color being overrepresented in the criminal justice system, and that also impacts a lot of potential outcomes. But they'll wait a long time, 10, 20, 30 years before getting help, seeking help. They may feel overburdened by their familial responsibilities and deny themselves the opportunity to get care. And when they do get care, they may have difficulty engaging in care. They may not feel that they can trust the healthcare system because other systems haven't treated them fairly in the past.
And that results in some terrible statistics, like a third of all those who are homeless are vets.
Right.
I think that then can play out in a way that goes beyond just difficulty or hard time getting care, but it can actually play out into altering your life, to being homeless.
Yeah.
Also, suicide is there's been such a lot of conversation about suicide in veterans, higher rates of suicide in veterans. Talk to us about that.
Yeah, I mean, you've heard the statistic of 21 veterans a day dying by suicide. That's really epidemic level proportions, and it's a problem that goes beyond what the existing healthcare system can obviously do. I mean, obviously, it's not being able to address that and stop that. And while there are solutions that are being developed to address that, focusing on the healthcare system, one of the things that I spend a lot of time thinking about is what can society do differently to create a more healing, welcoming, recovery-oriented, recovery-enabling environment for individuals that are suffering. I mean, there just seems that there's a missed opportunity for us to work together as citizens outside of professional healthcare environments to wrap our arms around people that are suffering and help them to find out what it is that they need and help them get there.
Where are the healthcare systems succeeding when it comes to veterans? Whether that's in mental health care or even, with those who are coming back with physical injuries, amputations, brain injuries, different things. So where are we succeeding, and where do we need to beef it up?
Well, there are a lot of pretty amazing cutting edge programs around traumatic brain injury, around suicide prevention that are happening within the VA system. I know the VA sometimes gets a bad rep out there, but there's actually a lot of really innovative programs. For example, using peer specialists to help with high-risk suicide prevention teams. So there are places that, what I mean by peer specialist is someone like you, someone that's gone through the same similar things that you've gone through. They've navigated the healthcare symptom. They've dealt with feeling suicidal. To have a person like that connected with you as part of the healthcare team really changes the way you might feel about getting care. And high risk, people that are identified as high risk for suicide, they get contacted 4 or 5 times a week. Someone calls them, someone goes to their house, they're seeing their provider regularly. I take care of several people that are on a high risk protocol. And that's necessary. You need a high level of care when someone is
high touch contact. Yeah.
Light touch and constant touch. So that's an area where I think there are positive programs that can be expanded. And the challenge is that it's not enough, right? It's not getting to everyone that needs it. There are still challenges some places with access, with availability of the services. But, as a VA employee, I have totally seen the difference in accessibility. I mean, it's been totally transformed where I work, at least. Seeing Saturday hours, evening hours, same day walk-ins. That, as a veteran, I know that was not true before. Trying to get in to see anyone was like a disaster. So, there's still a long way to go, but a lot of people working to try to make things better.
That's so good. And how do you think the faith community, what can we do better for our veterans? How can we serve them better? How can we serve their families, maybe while they're deployed? But how can we not only help them as they return, but particularly those who are experiencing what some have called the hidden wounds of war, that PTSD, or the wounds that they don't have a visible injury, but they're coming home very scarred, very wounded. How can the faith community come alongside veterans?
Yeah, that's a great question, because it is true that if you were an amputee, or if you had an injury that was visible, you have a different reaction. People have a different reaction to you in that situation. But if you have an invisible wound, you may not even know. And for a veteran dealing with that's within a faith community, the most important thing is to be seen and recognized. And I think that that happens kind of on a person-to-person level. And members of faith communities, I think, can try to educate themselves. And there are some free, wonderful opportunities to get educated more about the military. I live in Georgia, you're in California. We have a high rate of service members and veterans in these states. Yeah. But there are a lot of states that do not have a high population of veterans. So, we have so many veteran service organizations, a lot of members there. But if you're in a state that doesn't, imagine how isolated a veteran would feel in that environment. So I think it's important for every faith leader and all faith communities to think about the people that they're caring for and who's not getting the help that they need. And veterans might be a subgroup of people that are being left out, or maybe they have unique needs that are being met by the general services. Veterans like veterans. We like to hang out with each other. So we learn from each other. Maybe you just have a support group. Maybe you just create an environment or a meet and greet or something small. It doesn't have to cost a lot of money. But just taking an interest or having an open forum is just some really practical next steps that congregations can do. One more time.
That's really funny. You provide entertainment along with your information. You were saying just what I hear you saying is be relational. That
Yes.
One of the great losses that veterans experience, especially those who leave the military, so not just those who've returned from deployment and maybe redeployed, but those who are leaving the military, to miss that sense of community and shared mission. And it feels like the faith community could naturally supply so much of that because, again, even though we might not have, I mean, obviously, like you said, there's always going to be a place where people who've experienced the same thing want to hang out together. That's always going to be, and that should always be present. But for those of us who don't have a military background, but we share the same faith, we share that mission in life, which is to honor God with our lives, or to whatever it is in that particular faith community. It feels like that should be a bit of a natural fit to
Right.
to create that place and that space where people then have a new mission, a new calling, if you will, that's shared, with other brothers and sisters who have not experienced military life.
Right.
I don't know that we always do that well, but it feels like that with some effort, we could make that happen more easily and more readily.
Yeah.
I have somehow misplaced my list of great resources. It's here somewhere. I found it. I found it. So you do entertainment with the lights. I'll do a card shuffle. I found them. So when we close, I want to give some of those resources that you and I had talked about. But I think probably the last thing that I would just say, if you had, there's a veteran watching today, and maybe it's somebody who's really experiencing a lot of stress, a lot of distress from the wounds of war. And what would you say? How can you encourage them today?
Well, the first thing I would say is that you're not alone. These conditions can be isolating, and people can end up feeling like they're the only one that's gone through it, that they're the only one that's suffering in that way. And it's important, I think, for people to realize that other people have been as bad or worse than you have, and they've gotten better. They've gotten help. There's hope for you to get better. I think that's even, it's hard when you're in a dark place. It can be hard to even imagine that you can get out of that. And I think it's, you've got to reach out to someone that you trust and tell them. Most of the times people know that things aren't going well with you. They don't know if it's okay to say something. And when you invite someone in by saying, hey, I don't think I'm doing that great, you might find people say, well, I was worried about you, and I'm glad that you said that. And I was really thinking about, how to help you and didn't know how. So speaking out, asking for help it takes courage, but it's really important. But also I would want to encourage you to know that there are so many great resources and treatments for you, and there's hope for you to get better.
I love that. You mentioned something that I meant to mention earlier. Maybe one of the barriers to getting care is, and there's so many positives about the military, what it fosters in people, the leadership, the courage. I mean, it calls out so many of our great qualities as human beings. And one of the things that might negatively be reinforced is in that culture of being strong.
Right.
And the perception that to have a mental illness or to be suffering from PTSD is somehow it makes you weak, or that you are not really a good soldier, and that good soldiers don't struggle, or that they carry it on their own. You must encounter that all the time. Just talk to us about that a little bit.
Yeah, it's why a lot of people want to use post-traumatic stress as the way to talk about it, because that disorder piece can be a real sticking point for some people. What helps so much in those situations is seeing examples of leaders who are willing to speak about their own experiences. I mean, that's using the structure of the military to be helpful. When you have a general, a high-ranking official come out and talk about their struggles with mental health and how they got treatment and how they went back and continued to accomplish their mission, that now signals that, wow, this person is not ashamed to talk about it. They got help. It's okay. The Comprehensive Soldier Fitness Program that was rolled out across the military is another example of integrating mental fitness along with physical fitness. So long history of physical fitness, and that's part of the military. But now they're starting to see that, mental health is really important to your readiness as well. And no one can take it for granted. with these wars, 15 years of fighting a war, I mean, that's a long time. People have been deployed and redeployed. That's an inordinate amount of stress. And so you need to protect yourself differently from that. And sometimes you need to kind of take a break and get the support that you need before you can get back out there. And pushing through, there's a time and a place for that, but it's not always the appropriate response.
So let me just give a couple of resources that I have found, and I know that you thought were really good too. One of them is there's a 6-week Bible study. So I've kind of arranged them. These are things that a veteran or the family could do at home. In other words, you can just do this in the privacy of your own home. You can either download this or you can look it up online. So start with those. One is called A Theology of Exile for Veterans and Iraq. It's a 6-week Bible study. And you can get that at soulcareinitiative.org. And did I say Iraq and Afghanistan? I think I did. Yeah, but it's a 6-week it's a Bible study and helping veterans to come back home and deal with what it's like to be reintegrating. So that's at soulcareinitiative.org. We'll pin that on the top of the Facebook Live. So if you didn't catch it when I'm saying it, you can see it. It'll come up. And another is Psych Armor Institute, Psych Armor, SPSYCHARMOR.org. And you were telling me you're very familiar with that institute. You want to just give a word about what that is?
I'm a board member, so I have to give a good plug for Psych Armor. They are incredible, and the CEO, Marjorie Morrison, is a force of nature, and it's such an amazing free resource that people can have, whether you're a healthcare provider, a veteran, a caregiver, an employer. There's so many focus areas that you can find a track for yourself to find high quality trainings. One of the things I recommend everyone do is the 15 things veterans want you to know. That's a really quick course that you can take. And it's something that really we need to continue to spread the word about, but there's just things specific to conditions, to how do you support, employment for veterans, how do you help with reintegration, and more courses are being added every day. So I think you should definitely go check that out and see, what courses there might be interesting to you.
That was psycharmor.org. And another one that there's a book, I'll hold it up and I realize it's going to probably show backwards, but it's called Soul Repair, Recovering from Moral Injury After War. That's a book that you can order, highly recommended book. Then if you wanted to find an actual in-person support group, Celebrate Recovery has welcome home groups for veterans. So you can, and they're all over the country. You could go to celebraterecovery.com and find a group in your area specifically for veterans. You mentioned offline, you and I talked about NAMI. We both love NAMI, National Alliance on Mental Illness. So it's NAMI.org, NAMI.org. Great, again, free. Everything that we're mentioning other than that book are all free. And then if you need immediate help, you're feeling suicidal or someone you're worried about someone, you're feeling like you're maybe not going to make it through this particular day. 1-800-273-TALK, TALK, and you can press 1, and that's the specific line for veterans. And so we want you to know there's immediate help. There's stuff you can do at home if you're not ready to branch out and ask other people, or there's welcome home support groups for veterans that we would highly recommend. Dr. Wren, Glenda, my friend, thank you so much for being with us today. It's just been a privilege to talk to you. I know you have a heart and a passion for veterans and their families, so thank you for sharing that with us. And if you are a veteran or a veteran's family or currently in the military, just want to say thank you. Now I'm getting, okay. Thank you. As a grateful American, I just want to say thank you for what you've given and the ways that I'll never know as a non-veteran or non-military family. There's things I will never know about what you have done and what it has cost you. But just in this moment, we want to say thank you so much. And thank you, Dr. Wren, for your heart's desire was to serve the country in military service, and God had a different plan for you. But I thank you for just the ways you've let him work in your life.
Thank you.
God bless you, everybody. Happy Memorial Day.